Good evening, everybody. Eva, you are muted. I cannot hear you.
So, good evening, doctors attending our webinar. I welcome you myself. My name is Eva Makar. I am the medical marketing manager for Osnutria, and we are happy and proud you are joining us in this amazing webinar. And we are very honored to have Dr. Muhammad Baghdadi, American Board of Pediatric GI and Chief Pediatric GI at UEE, also clinical professor at Khalifa University. So thank you, Dr. Baghdadi, for being with us, and the floor is all yours. Just before we start, a small announcement. This meeting can carry up to 500 attendees. If we have more than 500, they will be directed to the YouTube. Please, if you join the YouTube, don't forget to scan the code on the screen and register your email so you get a link after the webinar of the evaluation and to get your certificate.
Shukran. Thank you, Eva, for this nice introduction. And thanks for Cabrita for inviting me to be with you all today. And we'll talk today about the benefits of goat's milk-based formulas in infants and pediatric nutrition. If I am correct, Eva, I see more than 400 people joining us so far, and that's really an excellent number, and I'm really enjoying this presentation today. I understand we have colleagues from United Arab Emirates, Qatar, Oman, Kuwait, Saudi Arabia, and Bahrain, and maybe other countries as well. So most of you are welcome. Throughout my talk, I will be mentioning some facts about the advantages and the limitations of goat milk-based pediatric nutrition in infants and older children. I will be happy to take your feedback and questions at any time. If you can post it in the Q&A area, that would be great, or you can save it till I finish the presentation. Obviously, we checked everything before the presentation. Everything was working, and now the slide is not moving. Wait. I don't know. Is it me? I cannot go to the next slide for some reason.
Let's discontinue the sharing screen and reshare it.
خليني أشوف. Wait. No.
Yeah, it worked, but it ran.
But it worked too fast.
Yes, exactly.
Okay. All right. I have no specific disclosures. So over the coming 40 minutes or so, I will talk on three main points: the background of the infant nutrition in general and the goat-based infant formula in particular. We'll talk about the different composition and compare the goat's milk with the cow's milk as well as with the standard, which is the breastfeeding. Then I will talk in details about the clinical benefits of using the goat milk-based formula. Starting by the background. As you all know, we have what's known as the Codex Alimentaris. And this was actually established many years ago, back in 1981. So that's like 40 some years ago. In the Codex Alimentaris, the group of scientists from different organizations, including the WHO as well as the Food and Agricultural Organization in the United Nations and other international food societies, they put the code together. And this code, what it says, what is the minimum and the maximum amount of any certain nutrient that should be in an infant formula. For example, they will say the minimum amount of protein should be, for example, I'm just throwing an example, 6 milligrams per 100 ml. And the maximum should be 10. So any infant formula should contain anywhere between 6 and 10, wherever the formula is being manufactured in Europe, in America, in Asia, or in any other place. and for any children and for any standard. So all the infant formula, they should contain the minimum as well as the maximum amount. And this is very, very important to make sure that whatever we are feeding our infants is safe and adequate. Safe, i.e., does not cause any deficiencies and does not cause any toxicities, and is adequate, that the child or the infant rather taking this particular infant formula will grow very well and will not develop any deficiency or any toxicity. Any infant formula licensed in any of the countries you are guys coming from have to obey this Codis Alimentaris. Obviously, it was started in 1981 and it has been updated throughout the years to be appropriate. So, if you speak to our colleagues in infant formula manufacturing business, they will tell you to make an infant formula, you need to have a protein source. And the protein source can be coming from an animal or a plant. So it's either animal origin or a plant origin. So when it comes to animals, you have several options you can choose. You can choose from cows, from goats, you can make it from camels, and maybe other animals. For example, some work has been done in donkey's milk. Well, I have my reservations on that. However, that's a source of the protein that it can be used. Why did they choose cows? For obvious reasons. There is so many cows around the world, and the cow does produce a lot of milk. So it makes sense to use the protein that's coming from cows' milk. For example, while the goat milk is less, the goat will produce less milk, and the goat milk is more expensive. So it makes more economic sense to use goats versus to use cows versus goats for financial obvious reason. However, the goat's milk is closer to human milk, and I will show you scientific evidence to prove my point when it comes to proteins, carbohydrates, and fat, and even other minerals. If you grew up in a farm or in a village, you know the average goat will produce around 3 liters per day, while the average cow will produce 25 liters of milk per day. So for one cow, you're going to need 8 goats to produce that amount of milk. And obviously, this is why the goat's milk is more expensive and more precious than the cow's milk. As I mentioned earlier, the most important thing is to make sure that the infant formula based on goats is safe. And this was published in 2012, like almost 13, 14 years ago, from the EFSA. The EFSA is the European Food and Safety Authority. EFSA is equivalent to the FDA in the United States. And in that publication, 13, 14 years ago, they said the panel have concluded that protein from goat milk can be suitable as a protein source for infants and for on formulas. So in the first year of life and even after the first year of life. So this fact has been established and accepted worldwide. Why did they say that? This table have a nice comparison about the different elements you can see here on the left side between the breast milk, which is the standard, versus the cow's milk, CMF, and here is the goat's milk. And this is the percentage of the compliance. Percent of compliance, what it means, the percentage of agreement or compatibility or resemblance of that to the standard, which is the breast milk of lactating women. And this talks, and you can see here, for example, the breast milk, the average amount of protein is, for example, 1 gram per 100 ml. In the goat's milk, the cow's milk, it's 1.45, and this is around the compliance is closer versus the goat's milk, which has a little bit more. And the same if you compare with the calcium, the iron, the vitamin A, the vitamin D, and so on and so forth, you can see that the goat's milk is closer than the cow's milk. Sorry, my pointer is stuck. Is closer than the cow's milk, and it has less amount of protein because the quality of the protein is better. And I will show you some slides talking about the essential amino acids that are there. When you talk about the minerals, you can see that the goat's milk-based formula, it has relatively more minerals, and that's closer to the breast milk composition when it comes to these very precious minerals. All right. So as I mentioned, the protein source can be of animal source or plants. Let's see what plants. Currently, there is infant formula based on rice. That's the source of the protein. It can be a soya that can be used, almond can be used, and any other plant can be used as a source of protein. So far, the rice and the soya are the commonest available for infants, while almonds and others are for older children. Obviously, the animal source of protein is closer to human milk because this is the mammalian kingdom, المملكة الحيوانية. While the plants is coming from a totally different source, so they are a bit far from the breast milk in general. All right, let's now discuss in details the composition of the goat's milk and compare it with the cow's milk as well as the breast milk. When I want to talk about the composition, I'd like to discuss the protein content, the fat content, we'll talk about the lactose, and we'll spend some time talking about the vitamins and the minerals in this formula. Starting by talking about the protein. This slide talks about the different composition of the protein in cow's milk in the first, the goat's milk, and the human milk. I think we all agree that the cow and goat's milk, they have more casein than the mammalian milk or the human milk. That's a fact. Let's now talk about the composition in details. When we talk about the casein in particular, I'd like to get your attention to the major component of the casein. The casein, why I picked the casein? Because casein is the one that causes problems. The casein in the human milk is mostly beta, while in the cow's milk is mostly alpha, and that's a big difference. While the goat milk, it has more beta than alpha. So when it comes to protein, the goat milk is closer to human milk. And this casein, the beta and the alpha, is very, very important differentiation because the alpha casein is the source of all the problems when it comes to cow's milk protein allergy and the indigestion, the feeling of fullness, the vomiting, the constipation, and so on and so forth. This is another way to look at it. Let's look at the beta. You can see in light gray the breast milk, followed by the goat's milk and the cow's milk. And you can see there's more beta in the goat milk than the cow milk, and it's closer to the breast milk. The alpha casein, which is the bad thing, the breast milk has almost no alpha casein. The goat's milk has a little bit, while the cow's milk has more. For example, the cow's milk have 38% and the goat's milk have 5 or 5.6%. So the cow's milk has around 7 times more of the alpha casein, and this is why we see a lot of these functional GI disorders, the colic, the constipation, the reflux, and so on and so forth. All right. This is a visual to remind you, again, if you grew up in a farm, probably you noted that this is the curd, اللي بالعربي بنسميها الخثرة, أو that's the hard part of the milk. You can see that the goat's milk, the curd is much less than what happens in the cow's milk. And in a clinical practice, what you see it in your patients, the mother will tell you in children who have reflux, when they vomit, they vomit this curd, أو الخثرة أو الحليب المتخثر, and that's what causes the problem of the infant. And this curd usually happens when the milk is exposed to the acid environment. Okay, and this is a study done in the lab discussing what's the strength of the curd and how much does it take to break this curd. And you can see the curd is easier digestible. It can be broken easily if it's a curd caused by the goat's milk versus if it's a curd caused by the cow's milk. And this was published around 6-7 years ago during the Espigan conference back in Switzerland. All right. So now we have talked about the casein. Let's talk about the whey protein. Although the breast milk has more whey than the goat's milk and the cow's milk, however, the whey protein in the goat milk is easier digested and it's more easy to breaking it up than the one caused by the cow's milk. And this was published in 2000 as well as in 2007 by different authors. So now I have showed you evidence the composition is different and the goat's milk protein is more soluble, easier to be digested, whether it's the casein component versus the whey component. Another publication was done, I believe, in 2006. They looked about the use of the human enzymes. So they brought some of these human enzymes from the stomach of human individuals, and they tried to see is it easier to digest the goat versus the cow's milk, and they found that the digestibility of the goat's milk is more versus the cow's milk. And again, this was an in vitro study published back in 2006. And we all know that when we drink goat's milk, you feel more comfortable than if you are eating a cow's milk. And actually the same thing, not only for the milk, for the other dairy products, for example, the cottage cheese from goat, it's easier to be digested than the cow's milk-based cheese. All right, now let's talk about the quality of the protein. As you all probably remember from your medical school, we have what's called the essential amino acids. What is an essential amino acid? The essential amino acid that you cannot produce as a human being, and you have to take it from outside. That's the essential. For example, the threonine, the isoleucine, leucine, lysine, cysteine, and phenylalanine, and valine, and others. Here is the comparison between how much is available in the GM, the goat's milk, versus the cow's milk. And you can see most of the essential amino acids are more available in the goat's milk versus the cow's milk. And that's very, very important because not only you want to give the protein, you want to give a quality protein. So the infant who will not produce these amino acids by nature, you have to provide it from outside. And we all know the importance of essential amino acids in the metabolism, the digestion, as well as the growth of these infants. So if a formula has more essential amino acids, definitely this formula is superior to another formula that has less amino acids, and this was published in 2019 in the Journal of Food Composition Annals. All right, so I talked about the protein superiority. Let's now move on to talk about the fat differences. And when it comes to fat, as you all probably remember, that if you have a short or medium chain fatty acids, it's easier to be absorbed because the short chain fatty acids, they can be absorbed easier and directly from the lumen of the intestine through the enterocytes to the bloodstream. While the long chain fatty acids, you need lipase from the pancreas, you need bile from the liver, and they don't get absorbed directly. They get absorbed through the lymphatic system to the lymphatic duct to the blood stream. So the short and medium chain fatty acids, they are absorbed faster and easier, and they don't require all that's there. As probably you all know, in patients who have malabsorption disorders, for example, patients with pancreatic failures like cystic fibrosis, or patients with bile duct disease or chronic liver disease or lymphatic disease, we give them a formula that's high in MCT percentage to make it easier for them to absorb. And also, when you absorb these fatty acids, you don't leave much of them there, so they cause less constipation. Because if the fatty acid is not absorbed, it gets bind to the calcium, and the calcium make what's called the calcium soaps, and these calcium soaps, they can cause this constipation, and they can cause abdominal colic and discomfort to these infants. The second part, that in general these molecules, they are smaller in nature. When they are smaller, the surface area is higher, so makes it even easier to be absorbed. Of course, most of the infant formula, they have been enriched with omega-6 and omega-3, and these are the AA, DHA, which are important for the neurological development, specifically for the eye and the brain development. All right, here is a table comparing the composition of the LC PUFAs, the N6 and the N3. Here is the goat versus the cows versus the human milk. You can see that the goat is higher than the cow's milk, but obviously the human milk is much, much higher. Adding these LC PUFAs, these polyunsaturated fatty acids, is expensive and technically difficult. Back in the 1990s, there was no LC PUFAs added to the infant formula. Then there was some good technology, so they can add some of that. Obviously, these LC PUFAs are still much less than the breast milk, but at least it's there, and in the goat's milk is higher than the cow's milk. This is one of the studies that was published earlier. They talked about comparing infants who receive versus the patients who don't receive these long-chain fatty acids in the infant formula, and they concluded that the children who did receive formula supported by LC PUFAs, they have improved cognitive functions, so they are a little bit smarter, and they have better cognitive abilities. I think most of the formula we have in the GCC, they are supported and enriched with these LC PUFAs. Maybe in other regions of the world, they don't add it, but I think it should be added to all infant formula for obvious benefits. So far I talked to you about the protein, the fat. Now let's talk about the lactose. Well, actually, lactose is found in all mammalian formula. It has a lot of benefits. Not only it's a carbohydrate and a source of protein, it has non-nutritional values. For example, but not limited to, it is a prebiotic. Well, prebiotics, it enhances the growth of the microbiota. Microbiota, it has short-term and long-term effects at digestibility, the functionality of the GI tract, decrease the colic, decrease the constipation, and so on. I think all infants should receive either breast milk or formula with lactose. You should not stop lactose. And honestly, in my practice, I rarely, if at all, I prescribe lactose-free formula. If you are concerned about lactose, somebody with a chronic prolonged diarrhea, somebody with villus disease, chemotherapy patient, blah, 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 you may use reduced lactose, but never lactose-free. The indications for lactose-free are very, 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 very limited, including galactosemia, for example. Other than that, everybody should be on lactose, and most infants, they not forced. 99.9999%, they are okay with lactose. Why I say that? Because breast milk is full of lactose. And before the invention of infant formula, all infants were on breast milk and they did very well. So lactose is always good. Second, if you have an infant, let's say he has severe diarrhea or whatever, and he's on breast milk, what you're going to do, you're going to continue breastfeeding. So this is why I don't use lactose-free formula, very rare, if any, at all. All right. So, but again, lactose is present in goat's milk as well, cow's milk as well, whatever other formula you want to use. It's almost 100% of that. So there's no advantage in goat versus cows when it comes to lactose. However, the goat milk has what's called the goat milk oligosaccharides, while the cow's milk actually it's almost zero when it comes to oligosaccharides. What are the oligosaccharides? Oligosaccharides are a group of carbohydrates that usually they are not absorbed, but they have the function of working like a excuse me, like a prebiotic. And again, we know that prebiotics are very important for the infant, whether it's in the short term or long term benefits. I think I'm missing a slide, but yeah, okay. So that's the bottom line that goat's milk formula, they naturally have goat milk oligosaccharides, which resembles to some extent the human milk oligosaccharides. So, talked about the protein, the fat, the carbohydrate. Let's talk about the vitamins as well as the minerals. Both goat and cow's milk are enriched with vitamins and minerals. And I told you at the very beginning that the Codex Elementaris defined the minimum and the maximum amount of each vitamin or mineral to be added there. So whatever formula you are giving the amount more than the minimum and less than the maximum for all infants formula. And that's easy to actually to achieve. But what comes more interesting is the bioavailability. Bioavailability, what does it mean? Although you are giving, for example, 10 milligrams of iron, that's might be good or might not be because it depends how much of that gets absorbed. So if you have a formula that has 10 milligrams of iron and the absorption, let's say it's 50%, you can absorb half of that, 5 milligrams. If you have a formula that the absorption is 75, so you're going to absorb 7.5. Although both of them, they have 10 milligrams of iron, but the higher the bioavailability, the better that formula is that. And that's related to different things, the protein and the other factors that help in the absorption. Couple of these were studied when it comes to goat's formula, including the iron and the copper, and they found that the iron and the copper are more available in goat's milk versus cow's milk in particular. The classical teaching, they used to teach us that goat's milk is poor in folic acid, and that's still very true today. But that's related to the fresh goat's milk. However, the infant formula based on goat's milk, all of it has been fortified with folic acid. I.e., if you have an infant, you put him in goat's milk based infant formula, they will receive an extra amount of folic acid and they will not develop folic acid deficiency. So you don't have to worry about that part. All right. So far I discussed with you the composition, the background, and all that. But now it's the time to put the goat's milk into test. Theory is good, but let's see when you give it to infants, what happens. This publication appeared in the Child Health 2005. And what they did, this is a very easy study. They did double-blinded randomized controlled trial. What they did, they have 72 infants. They randomized them to receive either GMIF, goat milk infant formula, or CMIF, cow's milk infant formula. Very simple comparison. And they watched them. They looked at them at different intervals, regular intervals. They look at their growth. And they looked at them, they checked their weight, their height, their head circumference, and they compared the goats with the cow's milk formula, and they found there's no difference when it comes to growth, i.e. they did not become overweight or malnourished when you compare them with the cow's milk based fairy. And this tells you that this is a safe and adequate formula to feed the children. When we say double-blinded, it means that the mother did not know because the tins all look the same, and the treating physician did not know either. Another publication around 10 years after that, or 6, 7 years after that, in the British Journal of Nutrition. And this was a double-blinded randomized controlled trial. This was a bigger study where they compared 200 infants. They fed them goat milk or cow's milk infant formula. And this time they did a better job because they compared them with the breastfed baby. And this time they looked at the nutrition, at the weight and height and head circumference, but more importantly, they did lab testing. They looked at, for example, the albumin to look about the protein absorption, the urea, the creatinine, hemoglobin, ferritin as a measurement of iron, the folate, because that was always a question, and more importantly, and what I love about this study, they looked at the plasma amino acids, again, to look at the essential amino acids there. Again, of course, they looked at the weight, the height, and all these things, and they found there's no difference in the side effects, the general health, sorry, the labs, the general health, or if there is any food allergy or dermatitis. So the authors in the British Journal of Nutrition, they said goat milk infant formula provided adequate growth, adequate nutritional outcome when they looked at these different lab testing like the albumin, the hemoglobin, the folate, the iron, the ferritin, and the essential amino acids. And this was a very important landmark study confirming to us that the safety and the adequacy of this. And again, this was double-blinded randomized, i.e. the doctor did not know or the mother, and obviously the infant did not know either. Type, is it superior? And that comes actually from several studies. There were several publications back in the 1990s to the 2011, 2017, and they looked at the stool character. I'm sure in your practice, every day you see an infant with colic and constipation, and the mothers always complain that the stool of an infant is hard, and usually it has what's called these fatty acid calcium soaks that makes it harder. And we all know as pediatricians that the stool of the breastfed baby is much softer than a formula fed baby. So in these three publications, and I'm sure there are other publications as well, they looked at the stool and they found that infants who are fed goat milk, 80% of them, they have better calcium absorption and less calcium left in the stool. And the stool characteristics of an infant on a goat's milk is closer to a breastfed baby, i.e. the stool of a goat milk infant baby is softer and easier, and there's less constipation, and it is closer to the breast milk fed baby versus the cow's milk formula. And we see that in our practice when you see an infant on a goat's milk formula, usually they don't have colic, they don't have constipation, and actually many of these infants, if they have constipation and colic when they were taking a standard cow's milk formula, if you switch them to a goat's milk infant formula, their stools become softer and with less colic. This was one of the studies back in 2011 by Hani and his group, and they found that most of the stools, they become pasty, and we know pasty is the breast milk, and this is the breast milk in white, this is the goat's milk, this is the cow's milk. And here they looked at the frequency per day, and again, most of them, they have 2 to 3 to 4 per day in the breast milk baby and the goat's milk, and the children with cow's milk, they usually have less frequent stools and more constipated unless the cow's milk formula has been modified with the prebiotics, probiotics, or symbiotics or others. And this is again saying the same thing. This was a larger study because it included more than 1,297 infants. And in this, what they compared breast milk, cow's milk, goat's milk, and the mixed feeding like breast milk with goat's milk or breast milk with cow's milk. And they compare all these 5 groups, and they found their growth is very similar. And the stool characteristics of the goat's milk is closer again to the breastfed baby. Okay. So, over the last 40 minutes or so, I discussed with you guys in details the advantages and the limitations of the goat's milk. I have shown you evidence that the protein composition of the goat's milk is closer to the mother's milk when it comes to the quantity of the protein, the quality of the protein, as well as the essential amino acids. The fat composition of the goat's milk is superior because it has more short and medium chain and the absorption is easier. The lactose is probably the same. However, there is a group of milk oligosaccharides there, and the cow's milk in general is zero unless it's added to the infant formula. I showed you that the vitamins and the minerals across all infant formula are very similar. However, the bioavailability of certain vitamins and minerals is higher in the goat's milk based formula. I showed you several studies that talked about that the growth is similar between the breast milk, goat's milk, and cow's milk to different variabilities. And I talked about the nutritional outcomes like the hemoglobin, the albumin, the ferritin, the folate, and all that. Actually, there is a superiority to goat's milk when it comes to gut health, as they have less constipation and they have less colic, and their stools is similar or closer to breastfed babies. These are some of my references, and I will be happy to take any questions here. And if Miss Eva and the organizer agree, I will stop sharing so we'll have the questions.
Thank you, Dr. Migdadi, for this amazing lecture. Very informative, very clear on differentiating goat milk. Why goat milk? What is the difference? We are happy to welcome your questions in the Q&A section in the bottom of the Zoom. And in the meanwhile, this means that the accredited lecture have been ended, and a small lecture about the product, our product Cabrita, will be starting now. I would like to, yes, here the share is working. I will share my screen. You can see my screen now.
Change it to, yeah, slideshow.
Yeah, now it's clear.
Yes, it is. Go ahead.
So I promise you it will be not too long, but it will be really informative to understand the goat milk in the market. So Dr. Migdadi have given us the scientific background of why goat milk and why to think about it. And in Cabrita and Ostnutria Cabrita, our product, we are very proud to say how Cabrita as a baby formula based on goat milk can fulfill the infant's need. So we usually start with this acknowledgement that is a deep belief in our company. It's not only a statement that breastfeeding is the best source of nutrition for infants in the first 6 months, and it would be perfect if can be extended to the first 2 years. And usually I say that it's not just a statement, it's a belief. That's why we use human milk as a gold standard in producing Cabrita, not any other milk. Me, myself, I'm a mother of two, and I have breastfed my two infants while working to Cabrita because I believe nothing like breast milk. But what if breast milk is not possible? I think most of you are pediatricians, neonatologists, even nurses and pharmacists. You can see the challenge of continuing breastfeeding if it is not available. For sure, we will go to animal milk, but which animal? Dr. Magdali showed for us that there is a lot of choices. So cow, goat, camel, maybe donkey's milk, because donkeys is the nearest to the human milk. It is very simple question. Let's go to the nearest possible available option, which is goat's milk. Why? Why to think about goat milk and Cabrita? Very, very simple. 4 reasons to go for it. First, Osnutria, which is the company behind Cabrita, is a leading company in the goat milk. We are the market leader in this category with over 75 years of experience, and this experience coming with along with our R&D department, looking to understand more and more the benefits of goat milk and how to formulate a formula to deliver as possible as much of the breast milk. It won't be the same, but the closer we can. And also one of the point of strength of Cabrita that we own the full production chain. We own the farms, the goats, the factory, and the final product, which have a very good impact on the quality of the product because we can also control what is the goat eating to produce high quality milk. As Dr. Migdadi mentioned, goat milk is a bit closer to the human milk. It is not the same and it will never be the same, just a bit closer. But is it safe? Dr. Migdadi already answered one of the questions that in 2012, the European Food Safety Authority approved goat milk to be based in infant formula. But along Cabrita as well succeeded to get the American FDA to be the first European product goat-based that met the FDA requirement. So Cabrita is both approved in Europe by the EFSA and in the FDA. So it is safe to use. So why it is unique? As we spoke in the previous lecture about the whey, and the whey is easier to digest, and this idea is coming from the human milk, subhanallah. The human milk is made 60% of the liquid protein whey, while 40% only of the solid or the cheese part, the casein. Fresh milk, cow or goat, have an altered ratio where the casein is much higher. In Cabrita, we have adapted these by adding extra whey from outside to make the ratio 60-40, exactly like human milk in terms of ratio, making our formula whey dominant, which means it's easier to digest. But also cow's milk are whey dominant. Those are available in the market. In this study, I think it was shown also in Dr. Magdadi's presentation, they tested the whey of the goat and the whey of the cow with enzymes. And after 1 hour, they found 77% of the goat whey have been digested versus only 17% of the cow. So it's not only about the dominancy, but also about the behavior. Goat milk protein, especially whey, behave with enzymes as it's digested faster. Sorry for that. So this is also can be a reason why to consider goat milk for your infants that are not possible to have a breast milk. Secondly, and I think this part have been very, very well covered with Dr. Migdadi presentation, is goat milk has less alpha S1. And my question for you, have you tried goat cheese and compared it to the cow's cheese? Even the harder goat cheese is softer than the cow's cheese. And the reason behind it is the less alpha S1 in the goat that make the curd formation, or when the acid met the milk in the stomach and the cheese is formed, it is softer, it is smaller in size, we call it sand-like percepted, very easy to the enzymes to penetrate. And to reflect this in your clinic and daily symptoms, you see less colic, less spit ups, and even less constipation because the protein digestion is much better and hence the bioavailability and absorption. This is a microscopic picture how goat milk forms sand-like. You can still see the black background, while here in the cows you can see oblique parts which they aggregate forming harder parts. But this is not the only comparison. The most significant part is Cabrita is A2 milk. And this is a new era of science where they are understanding that human milk and goat milk are both labeled as A2 beta casein, while cow's milk are labeled A1 and A2. But what is A1 and what is A2? It's a beta casein which is dominant in human milk, in goat milk, and we have beta casein in cow's milk as well. But the arrangement of the amino acids make a significant difference in the digestion. Let's see how. When they look to the beta casein of the human milk, they find only one type, prototype, which is A2. And this type is nominated after the amino acid number 67, where they found proline. When they look to the goat milk, they found the same arrangement and the same position 67 is occupied by proline. When they look to the cow, they find two prototypes. One proline, which is A2, but the other half they found histidine. And histidine may affect the digestion. We don't know. Let's see. If the enzymes come to digest, they found that histidine have a very weak bond with the amino acid 66 before it, and a small peptide of 7 amino acids is formed and is called beta casomorphin 7. It's a bit complicated name, but it has a meaning behind. Beta caso because it's a beta casein. 7 because they are 7 amino acids. But morphin, this means that this small peptide bind to the morphin receptor in the GIT, giving morphin-like reaction. How you can see this in your clinic? If the beta-casomorphin 7 from A1 milk is produced, the first thing will happen is alteration of the gut microbiota. This molecule will bind to the receptor, giving excessive buccal production, and this is not the best environment for the good bacteria. They will start to drop in number and diversity, and hence the digestion will be worse, which means colic, gases, and crying will appear. This is one of the symptoms. Also, allergy may be developed due to the release of the histidine, and histidine can be a precursor of a histamine. This can start locally, so inflammation of the GIT, and as you know as a pediatrician, if the GIT is not fully mature, it has open gut syndrome, which is a leak points. This can drive to the blood, giving more systemic allergic reaction. And finally, they found that babies that have beta-casomorphin 7 have increased level of inflammatory markers. This can give an answer why some infants cannot tolerate cow's milk, because there is a diversity or there is a change in the protein, especially in the beta-casomorphin 7 or the A1 milk. And in Cabrita, we are very happy and proudly to say we are A2 milk by nature. I will ask you a question. I can't hear your answer, but answer it between yourself. Have you seen how many special formula have been derived from the cow's milk? So now we have the standard cow's milk, and then we have the anti-colic, and we have the anti-constipation, and we have the anti-allergic or the hypoallergic. All of these is derived from the intolerability of the cow's milk. And one of the major reasons behind the intolerability is A2 milk and A1 milk, and also the excess alpha S1 present in the cow's milk. That's why goat milk still can be better choice if breast milk is not there. The other part, I think Dr. McDaddy was very, very perfect illustrating it. Cabrita has only lactose as a sugar. No added sugar, no maltodextrin, no corn syrup, no sucrose, no fructose. And if you look to all comfort formula and hypoallergic formula, they all have these artificial sugar. Why lactose is important? Basically because it is there in God nature. It is in human milk. Lactose is the main sugar. Also, lactose is a prebiotic. Lactose has a moderate glycemic index and sweetening value, which means weight gain because of the sugar and sustained blood sugar is much better when the formula has only lactose. And this means also that the babies in the weaning stage at the 6 months or 4 months, depend on your practice, will not have a difficulty to be welcoming new taste, the new food. They are not used to the sweet taste. And also it is very good in the co-feeding. If you look for a formula for only the night time or only the working hour time for the mother, or only in Ramadan during fasting time, Cabrita is a very good co-feeder because it has only lactose, no diversity in taste, and the baby will not leave the breast milk toward the formula. Finally, the presence of lactose is very essential for the absorption of minerals like calcium, vitamins, magnesium. All of this is very essential. So I emphasize on Dr. Mikdadi's message. Please don't compromise on lactose for comfortness, for hypoallergenicity, for colic. The reason is not lactose. It is normal that the infants are born with low lactase and it then increase by time. But no infant, or not no infant, but it's very rare to have a true lactose intolerance where the infant cannot use a baby formula with only lactose and no added sugar. Also, it was mentioned, and I will just emphasize on this part, goat milk has more prebiotics, but in Cabrita we have studied it and we found that Cabrita fresh milk, even before we produce it to powder, have 21 type of GMOs, goat milk oligosaccharides, and they have been studied to be effective as a prebiotic. So they protect against pathogen, they promote the good bacteria, they stimulate the immunity, and also the adhesion of the cells, gut cells, and maturation. But because they are natural occurring, we cannot rely 100% of them because they fluctuate. We have added galacto-oligosaccharides to the formula with a concentration 400 milligram for each 100 ml, which is, I think, one of the top quantities of a prebiotic in the market to ensure that infants using Cabrita will be delivering or having a very big diversity of prebiotic that can work to enhance their gut health, their immunity, and their digestion. The third part is the fat structure. I think also it have been demonstrated. I will just focus on the part is Cabrita has the highest OPO fat or beta palmitate concentration in the market. What is the beta palmitate? It is a short chain acids, fatty acids that have been cut to make sure that oleic acid are in the peripheral, which means it has no tendency to react with calcium. No calcium soap, no constipation. Constipation have been reported, the most reported complaint in infants on formula fed. And then the absorption of calcium are much higher. The absorption of fat is even enhanced, and the gut microbiota will not die because of the calcium constipation formed. Less crying and even better sleep. So I encourage you in your next constipation case in the pharmacy or in the clinic, look for Cabrita as the highest one in the market containing highest OPO fat or beta palmitate in the market. We are happy also to mention Cabrita is palm oil free, is soya oil free, also soya lecithin free, so the product is 100% soya free. And it has only sunflower, coconut, rapeseed, but also these oils have been treated to convert them to OPO fat or beta palmitate fat. What about vitamins and minerals, especially folic acid? Fresh goat milk lack folic acid, and if infant is nutrient on or fed on fresh goat milk, they are at high risk of developing megaloblastic anemia, and this is a very critical case. In Cabrita, we have fortified it with 22 types of minerals and vitamins, including folic acid, which cover more than 100% of the daily recommended dose, to make sure that there is an adequate, even minor elements in the formula, like vitamin B complex, vitamin D, calcium, iron, taurine, L-carnitine, all of these have been added. So it is a complete formula. And what I usually emphasize on, you can get the benefit of comfortness with a complete protein, not hydrolyzed, no change in taste, no artificial sugar. You can get the benefit of no constipation formula with Cabrita. You can get the benefits of only lactose in Cabrita, and you can get all the minerals you need in Cabrita. We also have omega-3 and omega-6 in both forms, linolenic, alpha linoleic, and omega-3 and omega-6 already formed. So we also cover this part as well. If you compared Cabrita to all comfort formula, they are either hydrolyzed and have artificial sugar. If not, they have palm oil or they have sucrose, and none of them have fats, which is very important for constipation. So to wrap it up, as I promised to be fast, Cabrita is the best choice after breastfeeding. Again, I am emphasizing if your patient is thinking to leave the breastfeed, please push. As long as she can, she is delivering the best for her infant. If not, consider goat milk as the second closer choice to the human milk, as it is adapted and whey dominant. This is unlike the organic formulas, which are not whey dominant. It is easy to digest whey, less alpha S1, so softer cheese and easier digestion, fast digestion of human milk, very big variety of oligosaccharides, and higher fat. And I have a question for you. Do you think Cabrita or goat milk can be used in cow milk allergy? I can't hear you. Some may say yes, some may say no. Let me, as a medical representative of this company, to say the answer is no. If you doubt your patient suffer from cow milk allergy, goat milk in the guidelines is not recommended as there is a cross allergy between both of them. But also, if you look to the literature, only 2 to 3% of the infants has a true allergy. Some of the symptoms are only intolerance to GIT intolerance, colic intolerance. So please diagnose this case very clear. And if you are 100% sure, don't use Cabrita. If it's only GIT problem, think about it. I think it will work and it's better than the fully hydrolyzed forms. What about lactose intolerance? And by this case, I mean the true lactose intolerance, where the infants are lacking the lactase enzyme, they miss the gene, and they will not produce it throughout their life. For sure, the answer is no. Lactose is not Cabrita is not a choice for infants who has true lactose intolerance, which means they will live their life on a lactose-free diet. But for those who are in transient phases because of antibiotic use, because of a transient bacterial, they are treated exactly like the human milk. We continue the feeding of Cabrita, or we can start with it, and it will cause no further complication. It is not a lactose problem. So thank you so much for being part of our webinar. We are now welcome to have all your questions. I will be the modulator and Dr. Mugdadi will answer the question and I will support in the branded part.
All right, perfect. Thank you, Eva, for this nice presentation. I think we can go ahead and start by the Q&A questions, if you don't mind.
Yes, we have received one question in the very early beginning, and this question I think is for you, Doctor. It is stating, what about, one moment, it was sent here.
What about the buffalo milk?
Yes, this is one of the questions.
This is from Dr. Muhammad Faiz Khan. Thank you, Dr. Muhammad, for this intriguing question. As far as I know, there is no infant formula based on buffalo milk, but I will not be surprised if a company will look into that. It takes a lot of years of research, as I showed you with the goat milk story. That started more than 40 years ago till it went through all the regulations and all the approvals and all the studies to do that. So the answer, I don't think so, but I'm sure in the future somebody must be thinking about buffalo and even maybe other animal cell source like camel's milk and others. And again, as I mentioned, people started looked at everything, even donkey's milk, but that's a different discussion for a different occasion, I guess.
Yeah.
We have another question, if you allow me. This is from Dr. Wafa Al Bashir. Dr. Wafa asks, how can dilute goat
Goat
milk
milk?
in goat goat milk in neonate and infant? You should not dilute it. I think the question, Wafa, maybe is the question, can we use goat milk in infants and neonates? The answer is yes, yes, you can. And you can start from day zero. However, if the mother has breast milk and willing to breastfeed, that's definitely superior to goat's milk or cow's milk or any other formula. I will encourage all my patients to use breast milk as much and whenever possible. Definitely, that's superior to anything. If you want to use goat milk or cow's milk, yes, you can. The same thing, you use it in a neonate or an infant.
Doctor, we have also one question. I think it was in the very early, so it doesn't show. Is uh, can we give baby 9 months cow milk diluted by water?
Oh, no, you cannot. You should use an infant formula till the age of 12 months. You should not use any other milk before the age of 1 year. That's not allowed. Even you should not use fresh goat's milk. If you want
Yeah.
to use a goat milk, you use an infant formula based in goat's milk. That's fine. We have a question by Dr. Hanan Omar. Can you give breast milk with Cabrita formula as mixed? Yes. And I showed you, remember in the last study where they have more than 1,000 infants, and they some of them were in the mixed feeding, i.e., goat's milk based formula with the breast milk. That's absolutely fine. But again, breast milk is superior to goat's milk, and all ladies should try to breastfeed as much as possible. Somebody do want to mention his or her name? Say, what about camel's milk compared to goat's milk? Which is better, and is there a significant difference? Yes, there is a difference between goat's milk and camel's milk. Please remember, we are talking about an infant formula based on goat's milk. We're not talking about fresh goat's milk versus camel's milk. Camel milk, it can be used after the age of 1 year, should not be used in a younger infant below the age of 1 year. So, camel's milk can be used, but after the age of 1, not for infants. It's not adequate for infants and it will cause problems for infants. So please don't use it. And not any other, actually, any other animal fresh milk. What about probiotic presence? Yes, some formula they have uh, formulas they have added probiotics. Miss Eva can answer if
Yes.
you.
So fresh goat milk has a more probiotic if you compared it to the cow's milk, but in Cabrita, we didn't have added probiotic in the formula, relying mainly on the prebiotic, the high diversity of prebiotic to support the gut health.
Okay. The next question for you,
I
Eva.
think it's for me, yes. So
Yes.
baby on Cabrita, can we stop vitamin D? No, we don't recommend. Cabrita has the adequate vitamin D in 1 liter, and none of the infants at any age will consume 1 liter per day. So it's better usually for the pediatrician to calculate amount of consumption and the vitamin D available in the back of the tin, and then add the needed vitamin D drops to these infants. So we don't recommend to exclude it totally. The formula have vitamin D, but it also has to be calculated and then completed from external source. Also another question about Cabrita. Please, is there HMO in Cabrita formula? This is a very good question. HMO stands for human milk oligosaccharides, and most of the formulas adding this label have a synthetic mimetic molecule of it, like the 2FL and LNH. In Cabrita, we have both or even more of the prebiotics, but they are GMOs, which are natural occurring. They have better action on the gut microbiota, so we don't add it outside. 2FL is present in the 21 natural occurring, along with a very big diversity of prebiotics that are actually occurring fresh in the goat milk and apparently in Cabrita as well. Um, I think I have missed one of the
There
questions.
is a question. How about for adults? No, wait. There is a question before.
Yeah, about
What
the
about
allergy.
suspected cause allergy? Goat milk for if you are allergic to one mammalian, you are probably allergic to the others. So if it's a true allergy, no, it does not. You should not use goat's milk. But if it's a functional GI disorder, yes, you can use goat's milk. But if it's a true allergy with blood in the stool, with eczema, respiratory problems, no, you should not. I think I'm getting. There's so many questions I'm getting missed here. Wait a minute. Let's make sure we are not missing. How about for adults or only for infants? No, our discussion today is about infants. But for adults, yes, you can use goat's milk, fresh goat's milk, or cheese, or whatever you like. Another question, can I give Cabrita for cow's milk? We answered this question. Should we use Cabrita in chronic diarrhea? Well, yes and no. It depends what's the cause of the chronic diarrhea. If it's an infection, that's different story. If it's a congenital anomaly, that's a different story. If it's an allergy, no. But if it's functional in nature, yes, you can. Eva, there is a question for you. Is
Yes.
Cabrit available in Saudi Arabia?
Yes, this is a good question as well. Cabrita is available in the Gulf, in Saudi Arabia, in UAE, in Qatar, in Kuwait, in Oman. And in Saudi Arabia, it's available in Nahdi, in Dawa, all big chains, and also it's available in the hypermarkets as well.
Another
There's a
question for
question.
what's the cost?
The cost. So it depends on your country, but the average cost is between 95 to 100 Riyal, Saudi and Emirati, the same. This is the average cost.
Another question for you. Is the CME approved by the Department of Health from Dr. Yahya?
Yes, it is approved. If you are from Saudi, you have to upload it by yourself to the website. If you are attending through YouTube, don't forget to use the QR code and register your email. All the attendees will receive a short questionnaire after the webinar. Once you answer it, you will get the certificate for sure.
Another question, can we use goat's milk-based infant formula in regurgitation? This is a question by Dr. Tariq Suhail. If the reflux is functional in nature, which is most of the infants, yes. If the regurgitation is by other causes, like allergy, no. But it's functional, like most of the infants with regurgitation, yes, you can consider that. Another one who do not want to mention his or her name said, I noticed that cow's milk is more concentrated than goat's milk. Is it because of the casein? I think what you mean by concentrated, remember when I showed you the picture of the curd, الخثرة هاي اللي بتصير? If that's what you mean, yes, the curd is more in the cow's milk-based formula versus the goat's based formula. If you mean concentration like in the composition, no, it's the same calories and same more other things. Protein is a little bit less, yeah.
Yeah.
If I use goat milk for neonates, this is from Dr. Iman Youssef, should I give folic acid? No, you don't have to. Just give them an goat milk-based infant formula. You don't have to give them folic acid. The answer is very clear.
Yeah, if I can just add to this answer, Cabrita is fortified with 12.9 microgram folic acid for 100 ml of the formula, which is about 120% of the daily recommended dose. And with a good bioavailability, we ensure no deficiency can happen with Cabrita.
Okay, Dr. Aji Fibin, Hi, sir. Until which age group we can give goat milk? The infants till the age of 1 year, and after the age of 1 year, you can give whatever you want.
Yes, and also from our company, we have products up till 7 years old. We have Cabrita stage 1, 2, and 3, and 4. So if the doctor would like to complete on a formula for any of the reasons, still goat milk available up to 7 years old.
And that's the same question for you, Miss Eva. Cabrita is given birth to six, and after 6 months, that's for Dr. In'am Allah Khan.
Exactly. So we have stage 1, which cover from birth up to 6 months, and then stage 2 from 6 months to 12 months. Stage 3 cover from first year to the third year, and stage 4 cover from 3 years up to 7 years.
Okay. Question for you, CME for KSE attendance. You answered that.
Yes.
Dr. Hanan Omar, have you know, or maybe now, any other formula based on goat milk other than Cabrita? That's the question for you, Dr. Eva.
Yeah, there is another brand in the market based on goat milk. Uh, we are not the only players in the market, but we are based on our sales, global sales, number one worldwide goat milk formula.
Another question, Dr. Hanan, متحمس على الأسئلة. Hanan,
Mhm.
Cabrita can cause obesity? No, it shouldn't, because it's the same caloric content of goat's milk versus cow's milk versus breast milk. And I showed you the codex alimentaris, which supports that. So the amount of calories is the same, whether you are using an infant, breast milk, or goat's milk, or cow's milk, and whatever brand. Except طبعا البريماتشور والاذر things, but الريجولار infant formula same calories.
مظبوط.
DOH, I mean Department of Health of Abu Dhabi, that's for you.
It is approved for sure. It is approved in UAE, in Saudi Arabia, in Qatar, in everywhere.
Dr. Hanan, she's asking, do you have Formula 1, 2, 3 for Cabrita?
I think, yeah, it have been mentioned. Yes, we have even four. We have 4 stages of Cabrita covering from birth up to 7 years old.
Okay.
I think by these we have completed all the questions. I have received some on WhatsApp. One of the question is, do Cabrita have DHA? Yes, Cabrita has both omega-3 and omega-6, DHA and AA, with the ratio 1 to 1, which is very unique ratio if you compare to the other available formulas to support the fast growing brain of the infants. How much a percentage of the short? What is the percent of the short chain triglyceride and the medium chain in the goat and the cow? So how much are they in the goat and how much are they in the cow's milk?
Is this question for me? That's for you, yeah.
Yes, I think it's present in the table you have showed as well.
No, in the table I mentioned goats in general. I don't know if you have it, if you have a percentage in Cabrita 1 or 2.
Uh, if you can check doctor slide number 31, I can share it from my side as well.
If you can, please.
Yes. So let me.
Anything close to 30 or above 50 is really high.
So I think it will work now.
No, that's for the MCTs.
Yeah,
Sorry,
because they are asking about the short chain and medium chain fatty acids
you go up.
comparison.
No, this is the LC PUFAs. No,
Even the C6 and C8 aren't considered the short chains.
no, these are long chains. Go
Mhm.
up, please. Go up, please. I don't know if I know how much there. No, I don't have the answer.
So the best is we can look for it and send it to you by email for this question.
I will Google it and try to find out
Yeah.
actually.
So I think by these we have answered all the questions. So let me again thank you, Dr. Mingdadi, so much for this informative question. Thank all the attendees for joining us for today. I believe this session was very informative, very eye-opening, and also got a good learning why goat milk and why it's now emerging and more people are looking for it. Thank you, Dr. Mingdadi, so much, and we are honored with your presence.
Thank you.
And
Thank
thank
you
you
for
all,
the
audience.
opportunity. And this was very nice.
Thank you, Doctor. I don't know why the camera is keep closing. So a final word, don't forget you will receive by email an evaluating link, a few questions about the presentation, and then you will get your certificate. If you are attending through YouTube, don't forget to use the QR code so we know who attended through YouTube, and use this QR code in the screen, and then you also will receive. If you face any problem, don't hesitate to meet us, to email us and tell you we meet you again. Thank you.
Thank you all. Thank you. يلا good night. صباح الخير.
Good night. شكرا دكتور.
يعني